Hello everyone. Hi. My name's Medic. First name's Medic, last name's Walf. I am an advanced practice registered nurse. I'm board certified in family medicine. That means I can see everybody from birth until death. I am licensed in the state of Florida. So if you are a resident of the state of Florida or you're down visiting during that time, technically I can see you, but you guys don't have enough money to see me. I do charge. All right. A lot of those fancy initials behind my name just mean that I did a lot of cool test taking, worked in a lot of cool environments. My favorite is the 1996 Tom Blanchard Middle School Substitute Teacher of the Year. Woo! And then if you stick through, I've got 50 copies of this wonderful certificate of attendance saying that you stayed for an hour and a half of Furst Aid essentials. So it just means you attended, doesn't mean that you're actually competent in anything that I asked you to do. And if you use it for work or school, they will know you're a furry, because I did a positive job on making sure you know. Cool? Cool. My lovely assistant / husband is up here. He's a normie. Please don't bother him. He does normie things. He's weird. And with that, let's move on. So quick disclaimer, information provided in this is intended for educational purposes only. Well, yes, I am a nurse practitioner. I'm not your nurse practitioner. Meaning, you have to pay me money for me to give you advice, and I do charge. All right? Please consult with a qualified healthcare provider for any medical concerns. Again, I do charge a fee. All right? In case of an emergency, in any regard, always call 911, even if you don't know anything else. So, today we're going to talk about CPR, first aid, heat injuries. Welcome to the state of Florida, 110 degrees, 110% humidity. Talk about opioid overdoses, the do's, the don'ts, stopping the bleed. This is where I'm going to have some of you guys come up here and do some fun aerobics. All right? And then, oh my God, it bent the wrong way. We're going to talk about bones. So, first things first. So, scene safety. As soon as you walk into any environment, you should scan the room to see, am I in a safe place? Are there downed electrical lines? Is there a shooter present? Is somebody running at me with a clown mask and knife? The answer is yes to any of these. Don't fucking touch anything. I don't want to have to treat two people because somebody was a dummy trying to be a cowboy, right? So, scene safety is paramount. Next, you're going to walk up to the person who looks like they may need help. As Megaplex likes to make it known, consent is key. So, first things, I'm going to walk up. Hey, you okay? Yes. Yeah, I'm not going to touch him. Cool. All right, that'll be $30. Thank you for the copay. If they do not respond, in the state of Florida, we have a law that allows you to assist the victim with any medical knowledge you may have. This is called Good Samaritan. Most states have some variety of this. So this means you come up, somebody's got a clearly broken bone, they cannot say yes or no that they're injured. If you help them and somehow injure them in some way, as long as you're doing so in good faith, you are protected. Cool. Next, stop. Stop everything you're doing and start directing people, right? So I'm going to just shout the word, hey, get command of the room, directly point at someone. You, call 911. Don't actually fucking do it. And then you're going to move on, right? Next step, CAB. If you guys have ever taken a CPR course or any first aid course before the last 5 years, you may have heard of ABC. We found that the one important thing that we need is blood to go to the brain. That's the first thing we should check, since it's the most important thing. So you're going to look for circulation. Everybody do it with me. 2 pointer fingers in the air. Find the trachea, the windpipe, right in the middle of your neck. Walk it over to your right. You should feel a pulse. If you do not feel a pulse, you're doing it wrong, or you're a vampire. If you're the latter, I have garlic and steaks. Yep. All right. So,
you have mashed potatoes though.
No mashed potatoes, just gravy. So, next up, if we confirm that we have a pulse, you're going to check their airway. Their airway should be open, should have nothing but their teeth and tongue. The teeth should be still inside of the gums. And if they have something blocking it, we're going to turn their head a little to the left or a little to the right. And you can do a singular sweep, right? If you do not feel comfortable doing a sweep, don't do the sweep, right? All this is you take 2 fingers, you run it around their mouth, and you pull out whatever you can get out. Do not jam your fingers all the way in or down, because you might cause a worse obstruction of the airway, all right? And then lastly, breathing. So, easiest way to do that, take your hand, put it on their chest, and then take a deep breath with me. Do you feel your chest move? If they're breathing, their chest will move. I promise, right? If you're really not certain, just assume they're not breathing, all right? So now what? Now I've got 3 vital pieces of information. Click next. If they do not have a pulse, you're not trained medical professionals, unless some of you are, because I know some of you are, so whatever. Why are you here to Furst Aid? Anything.
For fun.
If you're not medical, you do not know to look for something called a DNR, a yellow ticket. In the state of Florida, if it's not printed on a yellow piece of paper, it is not valid. A DNR is do not resuscitate. That means do not pump on my chest, right? For the matter of just bystanders walking into a situation, nobody has a DNR, you're still protected under Good Samaritan. Once you determine they do not have a pulse, you're going to take your hands, both of them. If you have one good hand, then use that one good hand. Take your right hand or your left hand, doesn't matter, pick one. This is your new dominant hand. You're going to place that hand directly on the sternum, right between the nipples. If the nipples are a little saggy, because some of our fine equestrian friends have the biggest bazingas ever, you're going to find the sternal notch, which is right below the windpipe. Walk your hand down, just slightly down, where you've got a nice flat piece of bone. And then you're going to take your second hand, place it on top, interlock your fingers, like the old, awkward turtle thing in high school that we used to do. My turtles, no, just me, okay. And then you're going to do, with your elbows nice and locked, a compression. But you're going to do that 30 times, and you're going to do it nice and deep. Yes, 2 inches is deep, right? Everybody? Men? Yes?
Yeah.
Very good?
Yeah.
2 inches is very deep. Very nice. And you're going to do it at a very fine pace of about 100 to 120 compressions per minute. Now, is anyone here a walking metronome? Cool. So sing songs, right? If you're boring, do the old staying alive. Staying alive, all right? If you're yeehaw, you're from the Panhandle, Alabama, the Georgias, Texas, etc., you're going to do Sweet Home Alabama. If you're a Yas Queen Slay, the classic Dancing Queen is appropriate. Please no Baby Shark. Right? If I come up on a scene, or I've got a paramedic rolling into my emergency room, and they're going, Baby Shark, do 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 do, I'm going to have such a sad day. Right?
Because what if they're doing Another One Bites the Dust?
A classic, but it's fine. Imperial March. My favorite is the Imperial March, especially on May 4th. May the 4th be with you. Or Revenge of the 5th. All right. Bob, if you're older than the age of 65, your AARP card is coming to you, I promise. All right. Jolene, only 2 people can do this. Dolly Parton and Beyonce. All right. Sorry. I don't make the rules. And then any RuPaul's Drag Race fans in here? Maybe. Sissy That Walk. All right. Pretty fun vibe. Get stuck in your head. The big thing is, right, if you're doing compressions on someone, the goal is to squeeze the sternum, that bone in the front of your chest, towards the spine. Because you want to squeeze that heart forcefully to the point of where blood is going from the ventricles up to the brain using the highway that is known as the vascular system. All right? So, at least 2 inches deep, at least 100 to 120 beats per minute. If you cannot or do not want to do mouth to mouth, totally fine. We found, right, in evidence, we found that bystanders are able to do compressions only more often than not. They felt more comfortable to do so if they didn't have to get icky germs, right, by doing mouth to mouth. And we found that we had higher chances of survival or out of hospital cardiac arrest survival. However, if you do want to do the breaths, really does help. It brings the oxygen level just slightly up. And you're going to do that 30 to 2. So 30 compressions to 2 respirations. So you're going to do counting 1 through 30. Anyone here have problems counting? No? Oh, you do? Then don't worry about counting.
No.
All right?
No breath, just push.
No breath, just push. But if you can, I would really love it or appreciate it if you could do those 2 breaths after you reach the number 30. They can be short, simple breaths. Take about a second for each breath, and then you move back into compressions. This buys the brain time, this buys the heart time, this buys the ability to get somebody back to life. Now, who has heard horror stories about compressions? Bones breaking, blood coming out. You're doing it right, okay? Compressions aren't pretty.
Nope.
No.
Friend in the back, do you have a question? Beanie?
Me?
Yeah?
Oh yeah, earlier you were talking about the mouth thing. They actually sell a few CPR masks for that, if that's something that you're...
Do the thing! Do the funny thing! So, yeah. Anytime I do these classes, I provide these super cheap plastic permeable membranes that allow you to do mouth to mouth without risking getting any funny thing. If I don't throw one at you by the end of this, you're more than welcome to come up and grab 2 or 3, all right? So, question for someone in here, just one person. Only one person can answer. What is the percent of oxygen in the air that we breathe?
In or out?
The guy in the purpley doodad shirt. 24? Ah, no. I know you know. 2? Now.
60.
No.
20 to 21%.
20 to 21%. Right, so room air, the air that you and I are breathing right now, is a mixture of a ton of different gases. Nitrogen being a large part of it, CO2 being another large part of it. But 21% of that air is pure oxygen. So, with that, second question. How much oxygen do we expel when we breathe out, when we expire?
18%. 20%?
No.
18.
18. You heard someone else say that, didn't you?
I said it first.
Oh, you said it first? All right, I'll give you something. So, a piece of my mind. Yeah.
Yeet. Oh, that was forceful. I apologize on behalf of them.
The 2 for 1.
Hey. Told you, blind squirrel with a lot of confidence. So, when we give somebody oxygen, we're not going to give them the full 21%. And that's fine, that's okay, right? We need at least like 17% to get some oxygen into the red blood cells and up to the brain. So they have something that's, if we don't do this, they'll get something called hypoxic, right? Eventually those cells in the brain and the heart, they'll die and they'll be compromised. Once they die, they do not work again. So with that, how do I use this doohickey? So, if you ever have to open this up, it is labeled for you. There's a top, there's a bottom, okay? You can wrap this like a mask around your face, and you breathe through this, right? Now, make sure you don't do what I just did and put it on backwards, because you're going to try and inhale and it's not going to work. It is a one-way valve, and you breathe through this way. The reason it's a one-way valve is because if they're full of food, full of drink, beverage, whatever it may be, and they die, their sphincters do not stay closed, and you may or may not get the vomit in your face. And this is not very fun.
Nope.
Anyone who's ever been vomited on, they know it's not very fun. So this prevents that. It prevents any of that seepage coming back into you, and it prevents your pretty little face from getting jacked up. All right, so next. So, doing a rescue breath. All right, after 30 compressions, provide 2 rescue breaths. Takes about 1 second each. All we're gonna do, we're gonna find our victim in the most compromising position possible. Always wear clean underwear, because one day you might meet me and I will judge you on your underwear. Right? And all you have to do, I promise, take your hand, put it on top of their forehead, tilt it back. Right? Now you can use a second hand, your other hand, place it under their chin, caress it gently. Hello, my friend. Long time no see. And lift that up. And then you can go in for the kiss of life and just go, whew. But please actually put your mouth onto their mouth. Now, if this is a child, right, someone who's itty bitty, you do not need to pinch their nose. You just place your entire mouth over their face, including the nose. If they are bigger and you cannot get your massive mouth onto their mouth and nose, you do pinch the nose. You pinch it tight. You don't want any air leaking out. And you just give a simple breath, like a breath that you would take on a normal basis. Not a deep breath, all right? We're not Olympic divers here. Just keep it simple, all right? Now, we go back to the beginning. Scene safety, BSI, all right? You're gonna check for a pulse. They've got a pulse, but they're not breathing. Odds are they're not breathing because there is a choking event that just happened. There is an opiate overdose that just happened. Maybe an overdose that's not related to opiates. Or they're diabetic and they stop breathing. They're in shock, right? This is fine. We can do this. What they need most is oxygen, and you will provide that doing rescue breaths. And the only difference here is we give them a breath every 5-6 seconds. So you go do the same thing, head tilted up, hand under chin, pinch the nose, and blow. For 1 second, you let them go, count 5 or 6 seconds, and do another one. If you don't do that, and someone who is in shock, overdose, etc., and they still have a pulse, then all you have to do is wait for about 30 seconds to a minute, and they will no longer have a pulse. That is your option. All right. Any questions so far? No? Bueno. Do you have the... Cool. So, AEDs. I've already told someone, as soon as I got into the room, I recognize there's a medical emergency. I've checked their pulse. I've told one person to call 911. I'm going to tell somebody else and give them the directive. You, with the funny cat ears and the beard, you're going to run and get the AED. If you don't know where the AED is, find someone who does. Okay? AEDs are in all publicly accessible buildings, right? They're usually mounted to a wall. There's usually an alarm that screams at you when you open it up. Do not be afraid of the alarm. The alarm is afraid of you. All right? The first thing you do when you grab the AED is push the button. All right? Turn it on. A lot of newer AEDs will automatically turn on as soon as you open it up. And it's going to start yelling at you.
Apply pads to patient's bare chest.
It will literally tell you what to do. And if you ignore it,
apply pads to patient's
it
bare
will nag
chest.
you and nag
Plug in
you.
pads connector next to flashing light.
So it will continue to tell you what to do. It has funny diagrams on it.
Plug-in connector.
It gets louder if you don't do it.
Do not touch the patient.
So,
Analyzing heart rhythm.
once the cord is placed in,
Do not
pads
touch
are on the chest.
patient.
it will tell you
Analyzing
not to
heart rhythm.
touch the patient. If you touch the
Shock
patient
advised.
while it's analyzing, it will get a
Stay clear
wrong
of
reading.
patient. Deliver shock now. Shock.
I'm going to pause it because I'm tired of talking over it. Big thing is, turn it on first, all right? That's the first thing you do. If you forget everything else I tell you today, just turn on the AED first. It will walk you through how to do something. The next thing is to apply the pads directly to the chest. Now, how many of you wonderful people have a ton of hair on your chest? It's okay, admit it, it's cool. We don't shave, we're not all twinks. This is all natural, no steroids here. All right? The cool thing is, these act as wax pads, and there's always 2. So, if I come up to you and you're a fuzzy little creature, or a not so fuzzy little creature, I'm going to place the pads on that I need to. I'm going to do a quick rip, 1, 2, 3, whoop. You get a free waxing courtesy of me, no charge to the hospital bill. And then I slap on these pads right here, bada bing, bada boom. If you're an adult, you use the big pads. If you're a bigger kid, you use the big pads. If you're a smaller kid, you make a kid sandwich, all right? So, for kids, you place one pad directly on the center of their chest, and then you place the second pad on their back. This way electricity can go from front to back, hits the heart, and we're good. For adults, we place one pad on the top right of their chest, right over the boobie, okay? Usually mid-clavicular, the collarbone's right here, that's the clavicle, right here. The second one goes underneath the left armpit. You slap that doohickey on, electricity will start your heart like an old Chevy Corvette. All right. So once you do that, you're going to insert the connector. This is the connector. It's yellow for adults, pink for kids. All right. Slide that doohickey on, and every one of these is different. They change colors, depends on the manufacturer. Worst case scenario, find the big pads, slam that sucker on, you're good. Okay? It's going to say pause, analyzing. It's my favorite time to think about my life. It's the longest 10 to 15 seconds ever. It's great. You can breathe for a second. And then it's going to say either shock or resume CPR. If it is a shockable rhythm, this is probably a very survivable rhythm called ventricular fibrillation. All right. If it says, oops, keep doing CPR, they might be in asystole, they might be in a non-shockable rhythm. It's okay, we don't shock everything like Grey's Anatomy. All right. Good news is, once you do shock, it'll tell you to go back to doing CPR. And then some of these actually give you a little metronome. Right? And then you can go through the metronome. Quick. So, any questions on CPR for breathing? Gentlemen in the back with masks first, then you.
Just a quick question. If somebody is putting on those adhesives not in the right place, like when an adult, they put it on the chest, what is supposed to happen?
You're going to burn them.
And it's not going to start.
It's not going to do shit. Right? So, what you're doing is putting a positive and negative lead on the person. And the electricity needs to travel from one point to another. Some AEDs I see are going to do something called a biphasic current, where it hits from right to left, then bounces left to right, and tries to restart the heart's own automatic, electrical system. I saw you first, and then you here.
What happens if you use an AED on somebody with a, albeit malfunctioning, pacemaker?
So, great question. It depends on what malfunction is going on. If they're just not, the malfunction is not working, right, then nothing's going to happen. The pacemaker can withstand that electricity. And what we'll end up doing is probably get a replacement on board. If the pacemaker is going crazy, oh yeah, if you ask a question, you get a prize. How I get you guys to talk, because furries are very awkward sometimes. If it is overshocking, right, what you can do, take a really large magnet, usually like from a subwoofer or something, place that bad boy on top of that pacemaker, stops the electricity. Just stops entirely, right? So, short of your answer is, if you shock somebody with a malfunctioning pacemaker, it doesn't do anything, right? It just works as it would for another regular AED. If they do have a pacemaker, usually it's going to be kind of in that right clavicular area. Some places will actually place it on the left for medical reasons. Just depends. But you'll find a big nodule right there. You can move it around. It's wiggly. It's fun. All right. Just put the pad right under it or right to the side of it. And then you. I see you, but you.
Because you said that if there's not a shockable rhythm, it'll tell you CPR. Will it continue monitoring and tell you when to stop CPR, or do you just keep going?
Yeah, so it'll continue monitoring every 2 minutes or about 5 cycles of 30 to 2, so 30 compressions to 2 breaths. 5 of those is about 2 minutes. It will reanalyze the rhythm and it'll tell you what to do. If it's shockable, then it will shock by you pushing the big orange button. If it's not shockable, repeat the cycle over until help gets there. All right?
So, for about the CPO questions, I'm sorry about earlier. So, as for someone with asthma, would the procedures be the same for CPO if someone is asthmatic or has bronchitis?
Oh yeah, exactly. So the question was, somebody has some sort of problem with their airway. They have asthma, COPD, bronchitis, emphysema. Their sister's cousin, best friend's uncle had cancer in the left big toe. No matter what the issue is, the procedure is going to be the same. The only time it slightly changes is if they have an anatomical defect, i.e. they have a trach, stoma, right? There's a tube coming out of their throat, right? They're on a ventilator. You're just going to change the position of where your face is going to go for the breaths. That's it. Make sense? Cool.
Absolutely no liquid can be present on the chest before you apply the pads, right? Or is some liquid available, right? Because for athlete training, the issue is that obviously they were training, they're training too much, and the body is still releasing sweat before you can even apply.
Exactly. So, when you apply an AED, if you're a sweaty Betty like me and you just have a bit of moisture on the chest, the pads are going to stick and it's going to be okay. But you're pulling somebody out of a pool. They've been in fursuit all day, right? They're hot, they're sweaty, they're more sweaty than you, they're soaked. Take off that clothing. You're going to take it off anyway. Do a quick wipe down, right? Use your shirt, your friend's shirt, their shirt, whatever. Or a towel that's nearby, rub them on the carpet, whatever. Okay? Don't rub them on the carpet. That's a joke. I have to legally say that. I feel bad for the camera person because they have to follow me right now. It's weird. It's cool. And I move around a lot. So, big thing though is if there's a ton of water, do wipe it off. It's less that it's going to shock you unless you're swimming in the pool with them when you shock them. Then that's kind of on you, homie. 1 second. And then, but if there's a little bit of moisture, the only thing that you might not have is good pad stickage. Make sense?
Yes.
On that note, what if they have like jewelry, like piercings?
Ooh. Zip zap. All right. I see you, friend, in the black shirt. Give me 1 second with a mustache. Cool. So, what if they have piercings, jewelry, etc.? Big thing is if they have necklace, neck jewelry, your job is not to worry about where that goes. Just fling it to the side. Just make sure it's not the pathway of the electricity. If they have nipple piercings, all you have to do is not place the pads on the nipples. All right? You're not doing. I think Mythbusters did this a long time ago. They took like flippers for like the grill, and they tried to like do that to like a dummy and cause an arc to happen. The arc that did happen was very small, maybe a first-degree burn with a little bit of a singe. It's a cool story. Not only did you die, but you got electrocuted at the same time. I mean, so if you're there to talk about it, it's kind of cool. Make sense? All right, so don't worry too much about jewelry. Friend in the black shirt with a mustache.
So what if they're having an allergic reaction or a certain symptom that caused due to a stressful environment? Because we had a couple cases at the hospital where the tongue swelled and they couldn't do the rest of the rows.
Yeah, exactly. So we're going to talk a little bit about anaphylaxis in a minute, but there are cases, house fires, where the oral airway is burned, steam. Any of you guys boil pasta and then dump that in the sink and then a lot of steam comes to you? That superheated gas can and will burn the inside of your nice oral cavity mucosa. Or you can go through Stevens-Johnson's where you literally burn from the inside out. You can have anaphylactic reaction where your tongue swells. You have angioedema, which is coming from, like certain medications, right? That stuff can happen. If you can't do the rescue breaths, don't worry about it, right? That's my job when we get to the ER, or the paramedic's job when they get there, to more than likely cut the throat and shove a tube down into the pipe directly, right? Your job in this moment, as a bystander, is just compressions at that point. Make sense? Cool. So, not yet. Last question.
What if they have, how sometimes people have like titanium arm rods stuck in their bones for like, if it's too broken, they take all the fragments out.
Yeah.
They just put a rod in there.
What about that?
Yeah.
So if they're Iron Man, nothing's going to happen, right? It's going to be totally okay. We've tested this on many people. Your spine's not going to get electrocuted if you have fusions. You know, if you have broken bones, the electricity's not going to go down this way. It's purely contained in that chest. Okay. All right, that was the last one for now. Let me talk a little bit about heat injuries. So we're in the state of Florida right now. Some of you guys are going to go to FWA or FWA, as I just heard it recently, and that was kind of weird. Or you're wearing these like 100-pound bags of carpet over your body. You're going to get hot, you're going to get warm, you're going to get toasty. So first off, the thing to do to prevent that is just drink water. Don't drink Gatorade, drink water. Right? If you're going to be prolonged suiting, then incorporate that a little bit of electrolyte. That's fine. But unless you're a rock star athlete like I am, all natural, no steroids here, right? Then you could do some Gatorade daily. But realistically, just drink plenty of water. Now, in heat injuries, we have two types of heat injuries. We have heat exhaustion and heat stroke. Heat exhaustion, all right, this person's going to be sweating, right, like I am. Whew. They're going to feel a little weak. They're not going to be able to do their PR at the gym, all right? They may look cool, pale. My family's from Finland. I look pale all the time. I got a little Irish in me, so sometimes I turn red, all right? But they'll be clammy, maybe, all right? They're going to have a very fast, weak pulse. If you check right up here, or if you check down at the radial artery, okay? When we go to 102, Furst Aid 102, I'll talk about the arteries. All right, they might have some nausea or vomiting, some muscle cramping, dizziness, headaches. Biggest thing is, you ask them what day it is, they'll know what day. They'll know where they're at, they'll know their name. They'll be awake and talking to you. All right, those are the big things that they will be doing. All right, so how do I fix this? If they're outside, move them inside. If you can't move them inside, put them under a tree. That doesn't really work too well here in Florida because the heat sticks to you. If they're wearing clothing, they're not anymore. Okay? Just loosen it up. If they're wearing jackets, if they're wearing a suit, tell them it's okay. They can spoil the magic this one time. We're not going to be upset. All right, take off that head. Get them breathing. Give them a cool, wet cloth. Maybe a cool bath. All right? Don't jump them into the hot tub. That would make things worse. I've seen that a time or two. Slowly sip water. What did I just say? They're going to be nauseous. There's going to be some vomiting going on. Do I really want to fill their stomach up real quickly with some ice cold beverage? No. They're going to vomit and puke, and it's going to be literally on you. Okay? So give them sips of water. All right? Nice, easy sips. Not of alcoholic beverage, of water. All right? And then seek help if they continue having these symptoms or they get worse. All right? And how are they going to get worse? Heat stroke. This is how it gets worse. The body temperature is now soaring above 102. They are getting literally, in all sense of the term, cooked, right? As the gym alphas would say. All right. They're going to be hot, red, dry. All right. The biggest thing that I hear a lot of people going is they're going to be completely bone dry. This is not true. They were just sweating profusely, and they lost consciousness. Are they going to be bone dry in that instant? No. They are, however, going to be red hot. All right? They may have some damp skin. They may be dry if they've been outside or in this stroke for a longer time. All right? They're going to have a rapid pulse, still weak. Biggest thing, everything that's highlighted in bold, underlined, is some form of altered mentation. They're going to have an altered mental status, whether that be a loss of consciousness, seizures, confused, all right, slurred speech. So just because somebody's wandering down the hallway of the convention, slurring their words, a little red in the face, and bouncing off the walls does not indicate they're necessarily drunk. They could be having a heat stroke. So pay attention to that. And again, nausea and or vomiting. Biggest thing, call 911, right? At this point, they're not able to do anything for themselves. Their body will shut down at some point. Number 2, again, move to a cooler environment. If they're outside, inside. If they're inside wearing a suit, get the suit off of them. Number 3, cool clothing, cool cloth, baths. Don't get them submerged under the water. All right, just a little bit of spritz will do. And then ice packs. Anyone know where to put the ice packs? You.
In between the legs, underneath the arms.
Yeah,
radial.
get jiggy with it. Under the neck, woo! Under the arms, with consent. They can't consent, so don't do anything wrong, all right? And then in the groin. These are all hot spots that will easily cool us down. The wrist, too. There's a documentary out there that talks about how kangaroos actually cool down. It's really cool. They dig up the dirt, they get that moist dirt, put it on their wrists. Bada bing. All right? And then continue cooling efforts until EMS arrives. Now, anyone here watch The Pit? Great show, love it. They tell you about how we stop cooling measures at about 102. The reason they stop that in that period is because if we drop them too fast, they could have other problems going on. Again, I don't have a rectal thermometer in all of you guys at this time, so I'm not going to monitor that right now. I'm just going to monitor you till EMS gets there. Question?
We skipped over, do not give the person anything to drink. I'm really curious about that. Why not?
Because anyone here work with a really drunk person who is vomiting, right? Yeah. You want to give them something more to vomit? No. And then the next thing is, if they're really drunk, are they really able to control all of their faculties here, right? So if I give you something to vomit up in your stomach and you're still actively vomiting, but you cannot stop yourself from vomiting or know to get to a toilet or something, the odds of that going into your lungs, pretty high. So now I'm no longer dealing with a heat stroke or a heat injury, but I'm dealing with an aspiration pneumonia. You know, your lungs get a lot of vomit in it. It's not very pleasant. Make sense?
Yes, thank you.
Good question.
So during that, mentally, what's happening to them?
Mentally, they're confused, they're lost, they're trying to survive. A lot of times your frontal lobe stuff, your personality will kind of disappear, right? It goes back down to brain stem mechanics, breathing on your own, and then eventually, if that gets cooked, you stop all that.
Kind of a related tangent, but very relevant. POTS, or postural orthostatic tachycardia syndrome. It has to do with the heart. It's triggered by heat. What do you do?
All right. So first off, what's your major insurance carrier? No, but reality is, right, in these situations, we don't have the time to really manage whether it's POTS or not. We have to worry about what is the immediate factor going to do to kill them. If somebody does have POTS and they're going to be in a heated environment, again, the biggest thing is hydration. If they're going through a POTS flare, then we need to sit them down, equalize their blood pressure, give them something to drink. If they're getting this bad, still call 911. Don't give them anything to drink because, again, they cannot control their airway. They cannot protect it themselves. And we just move on, right? If we want a more in-depth conversation, we can, but I don't think it'd be very pertinent or I wouldn't have the time available to get that deep.
Okay.
Is that fair?
Yeah.
Cool.
But is it something to tell 911?
It is. I'm going to be fair with you. Any of you guys here, EMTs, paramedics, work in dispatch?
I'm
Yeah.
a dispatcher.
Yeah, cool. So dispatcher gets a lot of information all the time, and they kind of know what to tell us. No offense. But they just, the important thing they need to tell us is what they tell us. Where you're at and what's going on. Tell dispatch they have POTS, or just wait until EMS arrives. If you're an EMT or paramedic and you hear the term POTS, you're going to be like, oh yeah, cool, they'll write it down and then they'll come and tell me. If you ever go to a facility that you live around or near and you've been there multiple times, it'll be in your record, I can see. So it's one of those things. Better to tell us than not, but it's just going to go down the chain.
Okay.
Cool. Awesome. Next. Oh, opiate overdoses. Cool. Anybody here been on X recently over the last 3 days, 4 days, right? And everybody and the mother, I love it. It's great. I mean, I brought boxes of it, right? It's talking about the Narcan they got on them. They got that thing on them, slaying it around. A lot of pushing in the noses. Anyone ever give Narcan here before? I know you. Okay. So, I've got some practice Narcan. So when I'm done here, my goal is to get done a little early so you guys can play with the cool toys. But I've got the little doohickey here. This is what Narcan comes in and looks like. All right. It's a little plunger, goes up the nose. Please don't put the practice Narcan up your nose. I don't know what kind of herpes you got. All right. But all you do is push it up the nose, high up as you can. All right. And then if they're breathing, we have a problem because you shouldn't be giving Narcan to somebody breathing. But if they are, push it while they're inhaling. We'll go through an overdose or an opiate withdrawal, and they'll wake up and they'll be upside spaghetti. If they're not breathing, just push it and then give them a nice breath of air, right? Do some mouth to mouth, try and get that nose involved so you can get it down to where it needs to go. Realistically, the Narcan is going to absorb in the mucosa that's in the nares and in the nose, so we don't need to go into the lungs. Now, here's my thing with Narcan. Love it. Great tool if you're in BFE, right? But right here, right now, you're in downtown Orlando, right? You are really close to multiple very high caliber hospitals. We got freestanding ERs down the way. The patient doesn't need Narcan. The victim doesn't need Narcan. They need air. What opiates do is they slow down central nervous system's ability to control breathing. They stop breathing. All Narcan does is it bullies the opiate off of those receptors. There's one big push. Sit in that receptor site, and then maybe the person starts breathing. In the meantime, what are they not doing? Breathing. So, here's what I'm saying. Carry the Narcan. If you have to give it, fantastic. But make sure you're comfortable giving some sort of respiratory support, whether it be mouth to mouth, or if you have access to a BVM, you know how to use it. I got that thing on me at all times, right? So I know what you guys don't got. So provide that respiratory support. The Narcan does fuck all if you don't do that, right? What the Narcan also does, if you give it and they are on an opiate, it will cause immediate withdrawal, all right? If you've ever been high on opiates and then you immediately withdraw, you're gonna be vomiting, you're gonna be cranky, right? You don't know where the hell you are. And there's going to be some random person wearing kitty ears staring over you like this. What are you going to do? I would start throwing fists, right? So this is a danger to you as much as it is a benefit to the other person, right? So use it cautiously, right? This only works on opiate overdoses. So the one thing that I love to see, I say that with as much joking as I possibly can, is when, and in particular, really passionate bystanders or cops, go up to Meemaw, who's got a blood sugar of about 40, which is really low, and start slamming Narcan all day, every day into the nose. That's not going to do anything. Doesn't fix diabetes. She needs some sugar, right? So, what to look out for? Unresponsiveness. Hey, are you okay? No response. Slow or no breathing. If they're slow in breathing, help them breathe, right? The goal is just to get them breathing. If they're not breathing, this is where we talk about the other stuff. How do I know they're not breathing because of an opiate? Pinpoint pupils. You open their eyes, you do the whole, hello, right? Lift up their eyelid, wide as you can. Those eyeballs, those pupils, are going to be very pinpoint, like as fine as a needle. There's not going to be any question as to they're pinpoint or not, right? And then blue or grayish skin. That tells me you're not breathing, you're hypoxic, all right? That's another sign. And then limp body. They're unresponsive, they're just limped over. You move their arm, you do the old EMS trick where you let it drop on their face and they hit their face, right? That's an opiate overdose. You need some air. So, check CABs, check for a pulse, because again, if they've not been breathing for quite some time, they're not going to have a pulse. You may need to do some CPR. Call 911, give Narcan. The Narcan instructions are always on the package, so you know how to do it. If they have a pulse and you give the Narcan, turn them to their left. Why their left, you ask? Great question, you. So, the way the stomach lays, right, anatomically, if we turn them to their right, we're allowing all the contents to spill out into their esophagus and down their throat. If we turn them to the left side, there's a hill it has to climb up, and if it can climb up that hill, congratulations, right? If not, most of the time it can't, you'll be fine, no vomiting will happen, all right? And then continue to monitor their breathing. Now, anybody know how often I should re-give this medication if it doesn't respond? You've already answered it.
2 minutes?
2 to 3 minutes, yeah. Give this man a Narcan. Right? So if it doesn't work the first time and you're really sure it is an opiate overdose, you can give the second one in about 2 to 3 minutes. All right? But the big thing is, realistically, don't worry about giving all the Narcan in the world. It's not going to help somebody who doesn't need it. Make sure you call 911 and watch the respirations. Mr. Mustache, you have a question.
Is Narcan covered by Good Samaritan? I
Yeah.
was told it's not.
It is.
Okay.
Narcan is covered by Good Samaritan. You can buy it literally off of Amazon. You can go over the counter, right? You've taken this class, you have the cert, congratulations, right? You're covered.
Now, question as well. So, is there, say you lay them on their left side, can you lay them on their back if it's on an incline? Is there like a risk of?
The risk is more prevalent there if you leave them on their back than not. If you're trying to give them rescue breaths and it's easier for you to keep them on their back and they are not actively trying to vomit, that's fine. But do know you'll be dealing with the consequences if they vomit.
I mean on like an incline, like against like a ramp or something.
Yeah, they can still vomit. That incline helps a little bit, but their head needs to be at 45 degrees. I don't know of any incline locally that's 45 degrees.
Yeah.
Right. Any other questions? Yeah, cool. So, big thing is be mindful. It can wear off. Narcan is inconsistent. It lasts between 15 to 45 minutes. I always err on the side of caution, say 15 minutes it can wear off, so then you reapply. What's up?
How much attention should we pay to the expiration dates of Narcan?
So, that is a good question. Good Samaritan doesn't cover if you give expired meds, right? If you give an expired med, you're willingly acknowledging that you're giving a medication that probably isn't going to work and could do harm to the patient, right? So ultimately, if you want to open yourself up to the potential of a lawsuit, cool, but I would err on the side of caution. Now, if it's somebody that you love, you know they're not going to sue you, they're going to be fine with you, give it, right? If it's within like 6 months of date, it should be fine. Again, not medical legal advice. But if it's like 3 years expired, just throw it out. This is free, or not free. This is really cheap. I can prescribe it if you have a physician, you have a nurse practitioner, you have a primary care. Literally walk up to them and go, hey, you write me a script for Narcan, the pharmacy will fill it, 99% of insurances will pay for it, and you get it free. Make sense? Who? You.
What temperature range should you keep Narcan? Like, if you have it in a hot car, would it still be okay, or is that going to happen?
Yeah, so good question. If you leave it in a hot car, I see you, give me 1 second. If you leave it in a hot car, will it go bad? Probably, especially in the Florida heat. Not very good idea. Try and keep it as room temperature as possible. So if you're gonna, travel around and you have a purse, it's best to keep it in your purse, your backpack, in your pocket. They sell these really cool leather, hardcore Narcan, holsters. I've seen Molotov with them. They're like, who's gonna OD today? Right? If you're walking around Wawa in the state of Florida, it's called the Wawa Special, where inevitably somebody will overdose on some sort of drug underneath the bench at Wawa. Okay? Always underneath the bench. Right behind you.
Okay, so you did say how long it has to be between dosages, but how many dosages can you give them? Like, after following up one after another?
So,
is there a limit?
I would recommend not going past 12 milligrams, which would be 4 doses.
Okay.
Right? But I've seen people who've been out in BFE give 7 to 8 doses and nothing happens. There are ramifications medically of this. Something called flash pulmonary edema can occur if we overdo it, meaning the lungs literally fill with fluid as fast as possible and they're now drowning, right? So I would limit it to 2-3 doses. There's a reason why there's only 2 doses in a box. Realistically, if you're in a situation where you need more than 2 doses, you're in the middle of nowhere BFE, and now you have to weigh other things. You should be doing more rescue breathing than giving Narcan.
I think the max I've ever come across was 8.
Yeah.
And they had called when they had already given 4.
Yeah. See, in rural environments, that's fair. What's up?
Black shirt, yellow.
Black shirt with their hand. Yeah. You.
Is it like, say someone were to go to somebody and they're not going through an overdose, is there any like bad reactions if you give it to someone and they're not actually having like an opiate overdose?
Yes, there is. It's not just an inherently safe drug. So like I mentioned, when you're giving Narcan, one of the things that can happen is that flash pulmonary edema, right? I don't know, I've never met anybody in particular who is allergic to Narcan yet. That doesn't mean that people aren't out there in the world allergic to it. So there could be a reaction that occurs there. And also, if you do give it and it's not an opiate reaction, what are you treating? right? You're not fixing the problem, which is the lack of breathing. So just fix the lack of breathing by breathing for them, right? Last one.
Okay. Let's say the nose, for some reason, is totally unavailable. Would something like under the tongue work, or out of line?
If you're coming across that issue, focus on breathing for them.
Okay.
Don't worry about anything else. Okay. All right. So, stopping the bleed. I need 2 sets of 2 volunteers. So you 2 come up. And then gray shirt and the fluffy paw. Yes, with the headphones. Okay. So, I was a combat medic in the Army for quite some time. Really enjoyed what I did. Learned a lot. One of the things that we learned in the last couple wars was that 20% of all trauma deaths are preventable, and preventable by simply just stopping the bleed. So one of the, as well as current climates, this is a very realistic thing that can occur. So time is super critical. In slow venous bleeds, can you do me a favor? Can you just put one on one person and one on another group of the team? So, in a slow venous bleed, the blood is just oozing or trickling out, right? You're going to do just direct pressure. Take a bunch of gauze, slap it on their arm, hold for 2 to 3 minutes, and then you're good, right? They may need stitches, so you can either transport to them to the hospital yourself, or if you're not comfortable in doing that, call 911. Whatever. Keep it simple, arms. For severe bleeding, you're chopping the veggies and oops, you slit your wrist and now blood is squirting into the roof, the next room, into your friend's croissant. Say it with me. Croissant. All right. If that happens, first and foremost, direct pressure, but you're going to need a tourniquet of some variety. So, these are tourniquets, right? You can keep these on for several hours. You're not going to lose your leg, promise. If you ever see a blue tourniquet out in the wild being used by somebody, this is a training tourniquet. It's not cleared to be used on live people for actual emergencies. It's purely for training. We reuse them all the time. If you have a tourniquet and you've used it once already or tried to slap it on your arm to play with it, it is now no longer a usable tourniquet on a real patient. So these will not and cannot be used on a patient in real life. I've used them too many times. They're weak. They could fail. So be careful when you go out buying tourniquets. I strongly recommend the CAT7, C-A-T-7, all right? And it's going to be through NAR, North American Rescue. They're pretty expensive, about 20 to 40 bucks, depending on where you get them. On the Amazon, they're more expensive. Directly from the website, they're a little cheaper. Recommend going directly to the website. And all you're going to have to do is open this bad boy up, slide it onto their arm or their leg, tighten it down like a ratchet strap, and then you're going to turn this doohickey called a windlass until you can no longer turn the windlass. It's usually about 1 to 2 full rotations. If you go past 2 rotations, you're doing it wrong. Right? Now, the really important one that we need to practice, these 4 nice young people are going to show you how in a pressure environment they're going to react. So their partner has a really gruesome injury, to be honest with you. There's some bones showing, like, man, that's wild. Right? So the goal is to put pressure and wrap the wound as much as you can and hold on to it for 3 minutes. Right? This is what I'm going to say. These people probably don't have anyone have practice training in this. Oh, hey, okay, all right. I'm not surprised. Cool. So, I'm going to show you what it looks like if you're maybe rusty on your skills, if you're not trained up in this really well, or if you are trained up in this really well, you might see the difference. Big thing is practice what you need to do in an environment. So, big thing is put a lot of that white gauze or bandage on the bleed, wrap it around several times, and keep hold of it. So, I'm going to give you guys 2 minutes. I'll give you a countdown.
Cheating, you're already prepping.
Hey, hey, I love it. All right, but this is why you need to practice. Get up here. Line up. All right. So, 3, 2, go. All right. So, in the event of a bleed, there's a lot of stuff going on. If somebody's hurt, injured, blood is a weird thing to look at. You might feel faint, whatever may occur. If you're not safe to help somebody out, find somebody who is, or train yourself to handle this on your own if you are injured. All right? The big thing is stopping the bleed as soon as possible and placing pressure directly on the injury is going to save that life. This is true for chest injuries, for extremity injuries, etc. Practice makes perfect. So these supplies are about 20 bucks on Amazon for 100 different rolls, gauze, and for like practice wounds, use some like expo markers or Sharpie or draw or something like that. Use Crayola. So, as they do this, do we have any questions on just bleeding? You.
What do you do if the victim faints?
What do you do if the victim faints?
The victim faints.
You keep working, and you check a pulse, right? You can't circulate blood with chest compressions if they don't got no blood. I saw you with the white strip first. Yeah.
What do you do if they have a little white blood cell count where they can't go fast, they don't have as much platelets in it? You don't have much blood, they can't go as fast.
If you know that about them, wow, you're really close. But number 2, just go really fast. I don't mean to be crass like that, but yeah, just go fast. Right? You next to him.
Is it recommended to pack a wound with gangrene or arterial bleeding?
It is best recommended. You've got like 10 seconds left. Oh, hey, look at you all. So, wound packing. I love it. Thanks for bringing it up. Wound packing with an arterial bleed. No. If it's in a place that you can put a tourniquet on, put the tourniquet on, stop the bleed that way. It is in a place like the groin or the axilla, then you can pack some, but you're going to be packing for a while. And if you know how to pack, then you probably went to like 68 whiskey school or paramedic school where they taught that. So I recommend staying away from that unless it is an extreme environment, and that I would recommend you go to a Stop the Bleed course, or you go to, if you're a medical provider, you can do TECC, Tactical Emergency Care in the regular environment, and then you can also do a Furst Aid. My friend, I'm sorry, let me move on to this next person. You.
What if it's the neck?
What if it's
you
the
don't
neck?
want to like choke them out with the wrapping, right?
Well, no, don't ever, if it's the neck, right, so from the neck down to your secure little hips, this could be a wound where you're going to need to do an occlusive dressing. So something plastic, non-permeable, gloves work really well. Honestly, the AED pads, somebody in the room is going to hate me for saying this, but you can just use those to slap on. That'll work as an occlusive dressing. Big thing is, if it's like the lungs, the neck, you want to keep that hole covered and keep air inside, blood inside. You.
Or, if it's become like an object, you keep that in, right? You don't like, hey, would you like wrap around it?
Don't pull it out. Just like everybody here was born, right? Nope, don't pull out. Pull out game's weak on that. Yeah, if you're an artist and you somehow get a pencil stuck in your hand, just keep that pencil in there. Yes, sir.
What about deep internal bleeds?
Deep internal bleeds. We're not surgeons. We're not going to be exploring anything. So if it's the abdomen, just keep exterior pressure as long as you can. If it's because they got hit by a baseball bat in their kidneys, call 911. And we're going to give them a little bit of diesel for medicine, if you know what I mean, right? So we're going to press on that gas real fast. All right, my friends, let's see how we did. So big thing is, if there is red, make sure it's covered. Good. Make sure it's nice and tight. If there is red, it is covered. Good. All right. We're going to keep applying pressure. So the one thing they all failed to do was keep holding pressure. Right. So once you, you're dead. So once you wrap them up, keep holding pressure and wait. You're now supervising or babysitting that person until somebody with more experience or a vehicle comes to you. Make sense? Cool. You guys did really good. I'm going to give you guys prizes before you go. Give a little applause. More masks. All right. Next. Hey, funny man with the clicker.
my bad. Yeah.
Okay, so fractures. All right, big thing in fractures, right? Signs of a broken bone. Pain at the site. Ow, I fell on my forearm and it hurts. Could be a broken bone. All right. Swelling or bruising. If it's the size of a watermelon and it shouldn't be the size of a watermelon, it's probably broken. All right. The femur itself, if that ever fractures, gets huge. Okay, massive. Those muscles will pull that bone like that. All right. If it looked broke, it's broke. All right? If you go, my leg shouldn't bend that way, and it's bending that way, probably broken. All right. If you cannot move the limb without them going, ow, it could be broken. All right. And the bone's like actually protruding, like OMG, probably broken. Right. If it's an open fracture, immediately call 911. Don't care what you're doing. If there's bleeding squirting out, please stop the bleed while you're also calling 911. This is why you need to command a room. Hey, you with the ears, call 911. All right. That way you can handle the patient. Someone else can call 911. Do not move the injured area unnecessarily. All right. If their arm is broken, should I be moving their arm all around? No. Those bones, when they're broken, if they're fully broken, are really sharp. You're going to tear muscle. You're going to tear tendons. You're going to tear ligaments. You're going to tear vessels, all that fun stuff. So don't move shit. If you can, immobilize the limb, right? Using a splint or a sling. For the arm, you use a sling. You just keep it like that. If they can't move their arm in this direction because their arm is in that direction, then you're going to find the straightest thing you can. Not yourself. All right? Some of you won't be able to find anything straight because that's just you. But find the straightest thing you can. If you're a dog, furry, or a wolf or whatever, find a stick. Go fetch. All right? A plank of wood. Something. You can buy commercially available items called SAM splints, S-A-M. They're moldable. They're really cool. I recommend you go to a course to learn how to use them if you do get them, right? But they're really straight, rigid things. Place it on there, and then you're going to take that gauze, or take your shirt, take their shirt. I like taking people's shirts off, right? Use that to wrap and keep it there. And then, if it is not an open fracture, you can take them to the hospital themselves, right? You can drive them, maybe they can drive themselves. I recommend you take them, all right? If it is an open fracture, or they are, in fact, not PMSing, then you call 911. Now, who knows what the P in PMS stands for? You.
Pulse.
Pulse. What is the M? Not you. You with the black balaclava picking his nose. Yes, you. What is the M? Oh, he went to EMR school a long time ago, and I help him out every now and then. I guess he's forgotten everything. So, stands for motor. If their hand is supposed to move and they cannot move their hand, call 911. If they do not have a pulse in that extremity, call 911. What does the S stand for? Anybody have a guess? You in the back. Sensation. Sensation! Give that person a mouth thing.
A mouth.
A mouth. All right. If they don't have sensation, if they're supposed to feel, or they have something called paresthesia, the pins and needles, the TV static, that is a 911-able thing. All right. Cool. For sake of time, I'm going to click next. All right. So this is it. First things first, I'm the realist. Right. Ensure your safety, right? When I went through AIT, when I went through combat medic training, it was the first time that I really ever considered that as a safety thing, right? They show us pictures of Marines going out trying to grab their battle buddy who's just shot by a sniper in Kabul. One goes out, tries to grab, bang, they're dead. Another person goes out to try and grab that person. Bang, they're also dead. 3 times. You think somebody's shooting at you, stop running out to grab it. So, ensure your safety. If you're in a hurricane, power lines are down, don't go towards the power lines, right? If you are in a fire, get yourself out of the fire. I'd rather have 1 patient than 2. You do not get paid to be a hero. You get paid to be put in a little coffin. That's what happens, right? Hands-only CPR can save a life. So, If somebody goes down, they don't have a pulse, press on their chest, please, 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 please. I don't care if you're doing it poorly, just do something. If you see somebody doing it poorly and you know how to do it better, step in. Stay cool, know your limits, go to school, right? Drink plenty of water, okay? Don't overdo it. Don't be pounding like 3-4 gallons a day. That's wild, all right? Keep it casual. If it's red, wet, and sticky, apply pressure. All right? I'm just going to leave that there. Seek out additional courses. Never stop learning. I mean, I started out, like I said, as a combat medic back when it was just EMTs. I became a flight medic, paramedic, and I went to nursing school, became a flight nurse, an emergency room nurse, then I became a nurse practitioner, and I'm still ever evolving my education, continue to go. Right now, my doctoral project is on the utilization of AI and deprescribing, because hyperpolypharmacy is the thing that kills old people now, right? And yeah, so if you just want a simple BLS course, which is what we just went through, but actually expanded a little further, about 16 hours. EMT school is about 5 to 11 weeks. CNA school, about 4 to 12 weeks, not as fun, all right? Paramedic school requires EMT, that's about a year. LPN school, about a year, 2 years. Just go to RN school, don't be an LPN, unless you really need to. PA, if you want to be a physician's assistant or associate as they'd rather be called, it's a 4-year undergrad, 2 to 3 years of additional school after that for a master's. Nurse practitioners require your RN, and it's a 2 to 4 year program, depending on if it's a master's or a doctorate level education. And then MD-DO is a shit ton of school, don't do it. Unless you really like people. Any questions, comments, concerns? No. Cool. So, quick next. If you want to reach out to me, please do. My Twitter handle /X is @MedicWalf. My Telegram is @MedicWalf with a lowercase w. If you want to look at my practice, if you're in the state of Florida, you can look up levelupAPRN.com. I do have my prices posted there. Not only do I do primary care, I also do health, life coaching. So if you have a chronic disease, issue like that, I can help you through that. If you have legal questions regarding the state POA, advanced care planning like DNRs, I can help you through that process as well. Big thing is, you know, feel free to reach out. Now, if you guys want to come up here and get a wonderful certificate, you're more than welcome to. I will have you do small tasks, like maybe CPR. If you want door prizes, you're welcome to. If you want to practice things, we can. If you want to chit-chat, we can. That's why I got the 30 extra minutes. So, enjoy.